Hi, everyone, and welcome to Heal Endometriosis Naturally with Wendy K. Laidlaw. Wendy has spent the last 2 years helping women with various stages of endometriosis to heal naturally after putting her condition into remission. After her own healing success from stage 4 endometriosis and adenomyosis, she's inspired to heal others, and her goal is to help some of the 175 million women know that there is another way other than painkillers, drugs, or surgery. This is the place to be for real talk with real people for real results, so you can learn how to heal your endometriosis naturally. Please note that the opinions expressed in this program may represent options, but are not a substitute for proper medical care. Before starting any new healthcare program, we recommend you consult with a health professional.
Hey everyone, it's Wendy K. Laidlaw here from Heal Endometriosis Naturally. I hope that this podcast finds you well as always. Now today I have a very special guest on with me, and I'm really excited to have her on because she was very integral in the final parts of my healing journey to not only save my sanity, but really produced most amazing results for me and help share what was going on in my body with those out there in the medical realm that didn't have a clue. Now, her name is Dr. Sarah Myhill, and thank you so much, Sarah, for coming on this podcast. It's so great to have you on here.
That's very nice of you. I do hope I live up to your introduction now.
well, I haven't even started yet. I mean, you know, you're a British doctor. You run your own specialised ME clinic in Wales, an author of 8 books. I mean, you personally assisted me in the final stages of my journey to help diagnose the mitochondria dysfunction. And I think you wrote to me at the time and said I had one of the lowest scores that you'd seen. So you know, you were just amazing on my journey. So I'm just in awe of you being here. But perhaps you could give some background to the listeners, you know, what your story is and how it led for you to be doing this amazing, impactful work that you do now.
Okay. Well, it all started, well, I was qualified in medicine in 1981 and went straight into general practice. And the first question my patients were asking me is, why have I got my blood pressure? Why have I got headaches? Why have I got urinary tract infections or whatever? And I suddenly realized that I had no answers to those questions. You know, I had a list of drugs that would suppress their symptoms, but they didn't want that, or most of them didn't want that. And so ecological medicine, or the style of medicine I practice, is all about asking the question why. Now, you take any problem, it doesn't matter if it's an engineering problem or a chess puzzle or whatever, you have to ask yourself, what is going wrong? You know, what's the problem? What is the mechanism of that? You know, i.e., why is that? And if you've got the mechanism, then you can start to put in place interventions that allow that person to recover. Now, you would think this would be fundamental to the whole of medicine. It ain't.
But that's why I love you, because I love that, you know, methodical mindset that you have, because it makes so much sense, doesn't it? It's not rocket science, it's basic biology.
Of course. And as I get older, my medicine gets more simple. And I now know that the basic things done really well get you an awful long way. And now I see as my role in life is to give people, as I call it, the rules of the game and the tools of the trade so they can fix themselves. Because guess what? The doctors aren't going to do it. Now, there are lots of very well-trained nutritional therapists, people like yourself who've walked the path, been there, done it, see what works, see what doesn't work. And you are going to be of a lot more use to people than some doctor, you know, sitting in his ivory tower with a prescription pad. Because symptom suppression with drugs, you know, okay, short-term gain, long-term pain. Why? Because we have symptoms for very good reasons. Symptoms protect us from ourselves. Now, guess what? If we didn't suffer the symptom of fatigue, we would work all day, all night, all day, all night, and we would be dead in 2 weeks, because nobody survived 2 weeks without sleep. So fatigue is a really important symptom. And, you know, another way to illustrate that is that if you imagine we've got a certain bucket of energy to spend in a day, that allows us, and we have to look at how we're going to generate that energy and then how we're going to spend it. The key point here is that if we spend more energy than we can generate, then we die, because the heart stops. So the body and the brain has to give us really nasty symptoms to stop that happening. It's exactly the same with pain. You know, fatigue and pain are the two big symptoms that are coming out all the time. What is pain? it's how the body stops us from damaging ourselves. I mean, one really good example is leprosy. And if you go to Africa, you see people who are suffering from leprosy, and they've lost hands, they've lost feet, they've lost ears. Why? It's not the leprosy. The leprosy attacks the nerves and gives them numb hands, so they have no sensation. And with no sensation in their hands, they burn themselves, they cut themselves, they get infected, and don't know they're causing the damage. So, you know, pain is a very important symptom, and we shouldn't be suppressing that with painkillers. Why? Because how do those painkillers work? They work by suppressing the immune system. They stop the immune system from fighting the infection or healing and repairing the damage, for correcting any injury that may be there. And so any drugs used to suppress symptoms actually accelerate the underlying pathology, i.e. we get sicker quicker. You know, we don't live so long, we arrive at an early death. So the first thing that we must all recognize is that symptoms are our clues. They guide us on our path to recovery. We mustn't symptom suppress. And of course, the commonest way of symptom suppressing fatigue is to use addictions. And again, this is a subject I talk about all the time, but you know, the obvious one is if you're going to a party, why do people have ecstasy? Why do they take cocaine? Why do they take speed? Because it gives them the illusion that they have endless energy. Yeah. And with endless energy, you can dance all night, you can be extrovert, you can be jolly, you can be funny, you can be quick-witted, but then there's the downside. There's then payback time. So addictions, and the biggest addiction, of course, is sugars and carbs, and I could talk about that all podcast if you really wanted me to, because I talk about that all the time. Sugar and carbs are the biggest addiction of all, and the trouble is, they're socially acceptable. They are not generally accepted as addictions. So now, okay, smoking, we've gone the whole hog with smoking. You know, in the 1940s and the 1950s, everybody smoked because that was the done thing. And then it started to come out that it was bad for our health, and it took decades before it's now socially unacceptable to smoke. Yeah, just wouldn't happen. And we will go through the same evolution with sugars and carbs. And what I'm saying is, don't wait for pathology. Don't wait for premature death with cancer, heart disease, dementia. You know, recognize that sugar and carbohydrates are driving our modern disease epidemics, and do something about it now.
Absolutely. Well, it's really interesting that you talk about that, because I work with women one-to-one, and they come through kind of like a 12-week online program. And part of that process is like week 2 is swapping out wheat. Week 3 is reducing and eliminating sugar because of the inflammatory effects on the hormones, you know, and all these different things. And it's really well known now, I think, isn't it? And I think people have to learn to go into a mindset of, you know, of not you're being deprived of something, but you're actually, you know, long-term health benefits can, you know, be very profound.
Correct. I have to say, you're a much nicer person than I am, because I dive in at the deep end, the very first conversation.
No, but I think I love you to pieces. I love your mythology. I love your approach. And I'm sure the listeners who are listening to this is what we need sometimes. We need to hear it. You need to shoot from the hip, and you just need to say it as it is.
Well, the paleo ketogenic diet really is the starting point to treat absolutely everything. And I don't do deals with people. You know, I don't say, oh, okay, you can have dairy products if you do this. Oh, okay, you can have a bit of fruit if you do that. It's non-negotiable. They absolutely must do that. And another quote I often hear myself saying, which is very nasty, is, my job is to get you well, not to entertain you.
Absolutely. No, I feel the same. I feel absolutely the same, you know, with my women. It's kind of like, this is making you ill, so you have a choice: stay ill or get well, you know?
Absolutely. And as you absolutely, and the bottom line is, there's only one person that can put food in your mouth, and that's you. Yeah. So you do have complete control. And yes, it's hard work, and yes, you will get what I call DDD, die off, detox, and diet reactions. You'll struggle your way through it initially, but in the long term,
it's so worth it to get the results, isn't it? I always remember you saying quite early on, and you know, working with you, that and it was, you made it so simple and so easy to understand, in that, like, you know, just literally the diet in itself isn't complicated. It's just doing what our great ancestors is, the caveman, cavewoman. And that really stuck with me, you know, that imagery of, it's not difficult, you know, we just live as clean and as out of plastic as possible, and as fresh. it ain't difficult, you know. So we complicate things because we don't put enough thought into it, or as you say, we're addicted to it because of stress or lack of awareness. So it's fabulous to speak to you in those realms, because we all know it starts with food, you know, because it's what we put in, it's what comes in, on and around the body, that the body's then showing up, isn't it?
Yeah, so I mean, and everybody's looking for another reason other than food, because they are so addicted, they can't, you know, contemplate life without. And they tell me, oh, it's, you know, the PK diet is boring, but it isn't boring. And what they do is they muddle up flavor with addiction. Absolutely. And the reason they say the PK diet is boring is because they don't get the addictive hit from eating a meal that they always get from their junk food, from their sugar, from their fruit, or whatever it is. Yeah. So when you really start boiling it down to, well, why do you think that and what is going on, you know, it's actually a very simple explanation at the end of the day, and you've got to hang on to it. But people, especially the clever guys, find rationalizations which are so convoluted, but they allow them to stick with their, you know, their carb-based diet. I had a guy who came to see me a little while ago who he's well into his 80s. I've actually been seeing him for years. He's a lovely guy, but and he is still refusing to do the paleo ketogenic diet. He said to me, the problem, Sarah, he said, the problem is I was brought up in the war when there was rationing. And, you know, during rationing, it was almost a crime to eat fat. It was a crime to eat protein because, you know, we just didn't have very much of it. So his rationalization was, you can take the man out of the 1940s, but you can't take the 1940s out of the man.
Absolutely. I think some people just get so stubborn. That's why I find when I work with women, I talk about, let's swap things out. Like, we swap them, because I know a lot of it's psychological, because once they get over that initial, as in detox, or, you know, that dieback reaction of not having these things, suddenly they're like, oh, my body's loving this food. Oh, my body's loving this. And oh, I've got all this energy. I'm getting up at 5 a.m. What's wrong with me? I'm like, what's wrong with you is you're not carrying around all those toxins and everything that's normally in your body. But I want to kind of circle back to when you began, because one of the tests that you did is so pioneering. And it has freed literally, I don't know how many tens of thousands of people. And I know I was one of them, that you were able, with the lab that you worked with, to devise a test which is so crucial to give people that kind of breather, that kind of, like, you see, I'm not a hypochondriac. This is not all in my head. So I wonder if you could give more background on that.
Yes. Well, of course, you know, throughout the, because I was one of the few doctors asking the question why, I seem to attract a lot of patients with chronic fatigue syndrome, because that is the worst treated condition in the world, bar none, and very common. Yeah. And so, of course, I was thinking about the mechanisms of chronic fatigue. And, you know, fast forwarding to now, I now recognize that there are 4 important players with respect to the body generating energy. Yeah. And an analogy I use all the time is the car analogy. So the diet is the fuel in the tank, and so many people are putting petrol in their diesel engines. Guess what? It ain't going to go well. Then we have what I call the mitochondrial engine, and I'll talk about that in 2 seconds. And then we have the thyroid accelerator pedal and the adrenal gearbox. And you've got to have all 4 of those, you know, at the same time, so your engine will do, you know, 50 miles an hour, hundreds of thousands of miles. Now, the key question here was the mitochondrial engine. And in this respect, you know, I was incredibly fortunate to be working with the best, the cleverest, most innovative biochemist in the world, bar none. That's John McLaren Howard, who was working at Biolab then and now at Acumen Laboratories. And I said to him in the 1990s, you know, I want a mitochondrial function test, John. You know, what can you do for me? Yeah. We looked at he looked at mitochondrial respiratory enzymes, and that didn't show much. And then he discovered a test that had been used for years as a research tool called ATP studies. Yeah. And it didn't appear to have a clinical application. So he said, well, I think this test, you know, might be relevant for your chronic fatigue syndrome patients. So he developed the test, and essentially it looks at various aspects of mitochondrial function. So it looks at how quickly mitochondria can make ATP, how well they can take ATP from the mitochondria out through the mitochondrial membrane and to the cell where it's needed to burn fuel, how efficiently that cell can use a molecule of ATP, and then how well ADP is recycled back into the mitochondria. So It wasn't just one thing, it was a measure of a number of factors.
Yeah.
By that time, I had accumulated 71 patients who they'd done the diet pretty well. We'd sort out the adrenal stuff, they'd sort out the thyroid stuff and various other aspects, and I was still very stuck with them. So I said, well, we do have this test. How's about it? Yes, please. So with those 71 patients, they saw me, and between us, we agreed a clinical energy score on the Bell Disability Scale. Oh, you're functioning about 10 out of 100 or 50 out of 100 or whatever.
Yeah.
We then sent the bloods to Acumen, who did the test, and the results went to Professor Dr. Norman Booth at Oxford University, who then analysed the results. And by measuring those various parameters, i.e. how fast you can make ATP, how well you can get it out, how well you can use it, and how well you can recycle it, we calculate an energy score. Yeah. And essentially, the higher energy score, the more energy that you were generating. And we published this paper in 2009. And what was so brilliant about that paper is that those patients with the worst fatigue had the worst mitochondrial energy scores, and those who were least fatigued had better scores. We then went on to publish 2 further papers, and the third paper asked the question, what happens to these mitochondrial energy scores after the course of treatment? Yeah. Now, mitochondria can go slow for 3 main reasons. They either go slow because they haven't got the raw material to work, yeah. i.e. so we have to give them the supplements, and the details of supplements in my book, or they go slow because they're blocked by something, they're inhibited by a toxin, which could be an organophosphate pesticide, it could be a heavy metal, it could be a cosmetic toxin, it could be products of the fermenting gut. Yeah. Or they can be blocked or they could be going slow because the control mechanisms aren't right. The thyroid and the adrenal glands are not good. Yeah. So by then I had kind of established those issues fairly well. The patients then put the regimes in place, and then we repeated the mitochondrial function test. And what was so wonderful is we had 35 patients who had done the regimes, and then we had 4 patients who, for whatever reason, hadn't done the regimes, but they still wanted to repeat their test. And the 35 who had done the regimes, in every single case, their mitochondrial energy score had improved substantially. Now, it's small numbers, but when you get such an amazing correlation, you then know the regimes are working. And guess what? That was paralleled by clinical improvement. They were getting better clinically. So the point is, even if you can't access these mitochondrial function tests, because there's only so many that Acumen laboratories can do, I can still give you the regimes, and they're all in my books, of what you have to do to improve your mitochondrial function. The supplements, so CoQ10, acetyl-L-carnitine, vitamin B3, magnesium, D-ribose, are the common rate-limiting steps. And then the common blocking factors, well, the products of the fermenting gut are very common blocking factors. And so just by doing the paleo-ketogenic diet and sorting out the fermenting gut, you're going to be freeing up your mitochondria. And that indeed may be one of the mechanisms by which so many people comment that their energy levels are improved just when they do the diet. It's also impacting on mitochondrial function. Yeah. And then, of course, as I say, we have, as I call it, the thyroid accelerator pedal and the adrenal gearbox that needs to be adjusted as well. Now, the joy about those 2 aspects is that we can do that without resorting to doctors. Yeah. Why? Because glandulars work fantastically well. And we can adjust the dose using clinical parameters. How do you feel? What's your core temperature? What's your pulse? What's your blood pressure? Easy to monitor. You can do it yourself at home, and then you can adjust the dose of glandulars according to your temperatures. And I say all the details free on my website. Anybody helps out, I can send you the handout and get it right. And why do you have to do it? Because the doctors aren't doing this. Yeah. Doctors these days are not treating patients. They're treating blood tests, but the blood tests don't reflect very often what's going on in that patient for many reasons, for reasons of thyroid hormone receptor resistance or whatever. Yeah. So, here we have, as I call it, the tools of trade to massively improve energy delivery mechanisms. And that's a very important part of the equation in treating anybody who has chronic fatigue syndrome or ME.
Absolutely. And it's fabulous that you were so passionate, and even just hearing you say it again, that you're asking the why. And that's so important, not just accepting what your training, I suspect, just gave you, because equally it's not the fault of the doctors in the mainstream. They're just a byproduct of their training, which has come from the government and pharmaceutical companies in a lot of cases, isn't it?
One of my favorite quotes comes from Winston Churchill when he said, my education was only interrupted by my schooling. And it's the same in
true.
Medical education is not an education, it's a brainwashing.
I completely agree. And do you know what? I've met some of the most amazing doctors like yourself who have been trained in the mainstream and then expanded their mind continuously and asked the why question. I've read books, spoken to, and they've gone, oh, but why? That doesn't make sense. My patients are getting sicker. Like I was like, when I had my multiple surgeries for endometriosis, and all the drugs and stuff, I was kind of like, but I'm getting sicker and sicker and sicker. Like there has to be another way. And they were going, oh, well, no, there's no other way. It's all in your head. And I'm like, no, I'm getting really, really sick. But I remember another test that you did for me was measuring the radioactive toxins or something on the membrane of the, there's
translocated protein studies. Yeah,
that's right. I think there was some radioactive thing that had shown up on there as well, which was, inhibiting the mitochondria. But for me, that test was such a relief, because when your body has failed you or is failing you, and you think you're doing the best you can, and of course we're all conditioned to go down the mainstream medical route, but you're getting sicker with what they're giving you. It's very, very disheartening, and a lot of people get stuck in that hamster wheel, for especially women with endometriosis. They can have something like, I've had women who've had 26 surgeries, and you're just like, no, it's not working. The definition of insanity is doing the same thing over and over and expecting a different result, So that's kind of where I began. But what was wonderful about you being able to measure the mitochondria was that's a very unique thing to be able to measure. But as you say, but equally fantastic that with just some very simple protocols, because they're simple, that actually the body's always, because the premise I work with my clients is the body's always wanting to heal itself. We just have to remove what's stopping.
Correct. And another important factor there is, I always think, is you only have to get the body 51% right, and it'll take you the rest of the way. If you're only 49% right, then you're still on a slippery slope downhill. And very often it's that last, little bit of meta-bead, that's last dose of adrenaline, that final tightening up of the diet, whatever, that makes the difference. And as soon as you're well, you just get better and better and better, because instead of having negative feedback circles, you've got positive feedback circles, because you need energy to heal and repair, and on it goes, and you need energy to sleep even. So, as I describe it now, getting people well is like conducting an orchestra. There's no point just hammering away at the violin. You've got to get everybody playing, and at the right time, and in tune, and then you get a melody that's worth listening to. So, people think, oh, I did the diet, oh, that didn't work, forget that, let's try something else, let's have a go at the power. No, we got to do it all.
Yeah, absolutely. And it's really interesting as well, because, you saying that, because diet is key. And I always start with women on diet, and then we move on to the products, obviously the xenoestrogens and all that's out there as well, because that can have a profound impact, on people's ability for their livers, and, what's going on in their skin and affecting their bodies. So I think initially people feel a bit overwhelmed, but then once you start getting the feedback from their body, they're like, oh my goodness. They're like, oh, I'm so hungry and I love this food and I love eating. And every woman that's worked with me has lost weight. They're like, oh, really worried about it. And I have them eating at least 6-7 times more than what they started with, because I get them to do food monitor sheets so they can actually pay attention to how their body's responding to what they're eating. And invariably they're not eating enough. And when they are eating, they're eating rubbish, because we've all been there and done it. But when they start eating well and healthily, and they get the digestive system sorted and things, it's incredible just how amazing the body is. I think that's what I got from my journey, was just like, wow, our bodies are amazing.
They absolutely are. They are miracles of engineering. And we don't have to be very clever, and we don't have to do much to make it work.
Absolutely.
People talk about detox regime, but they're very simple. I mean, sauna sweating regimes get rid of an awful lot of nasty chemicals. Just taking supplements and doing a PK diet helps one to detox. And all the techniques that I detail in the books are all things that you can do yourself.
Absolutely.
You don't have to go to an expensive clinic in South America and spend a fortune to get right. You can do it yourself. But as my daughter put it, you just got to get your shit together.
And that's it. I think, you know, people can get stuck. I think people can get worn down by conditions and then they just give up on themselves, and it's just never giving up on yourself and saying, right, and making that commitment to yourself to start on this new path and never giving up. As Winston Churchill said, never, never, ever give up. Because, and I loved you used to have that stork and that bird thing, that image. I used to have that on my fridge, you know, because sometimes I felt I was being eaten up by this condition and I couldn't understand it, because trying to explain to people what chronic fatigue is like. And I know you've written a paper, or you wrote about, you know, the abuse that a lot of patients get with the chronic fatigue, because it's so poorly understood and it's so heart-wrenching. And I have joked, it's not funny, but I have joked with, you know, doctors in the past who had this very patronizing person who basically drew little stick figures and a little van on a piece of paper and said, now what doesn't happen is this van doesn't come along and suddenly give you this condition. What do you think is going on? And I'm like, well, I'm here because I said, did you genuinely think when I was a little girl, I thought, I know when I grow up, I want to be bedridden and high levels of chronic pain and have no quality of life. That is not an aspiration for people, you know? So it's interesting. You talked about, you know, you talk about pacing and all that kind of abuse that people can get in the medical system.
Yes, yeah, absolutely. And I'm not sure if you're aware of the PACE trial, which was a study done in London by psychiatrists and published in The Lancet in 2011, which it was a psychological study, and the upshot, or the results that they announced, was that patients could be substantially improved or cured by graded exercise and cognitive behavior therapy. Now, doctors like myself in the know knew that had to be wrong. Yeah. So we did a Freedom of Information Act search, and we said we want to see the original data to prove, you know, your figures, and they refused to let us have them. We had to go to the Information Commission, and eventually we did get the raw data. It was number crunched by a doctor who's also a statistician called Keith Garrity, and he showed that they had made the study up. They had done badly. It had been wrongly done. Patients, they weren't properly blinded. The endpoints were changed. You know, it was a very poor study. And it cost, guess what? It cost, they used £5 million of public money to do that. You know, to cut a very long story short, Garrity's findings were backed up by over nearly 200 experts all around the world. And on the back of that, I reported the authors of the PACE study to the General Medical Council. In order that they should be investigated for scientific fraud and for financial fraud. Now, of course, the GMC and these psychiatrists, they all sing from the same hymn sheet. You know, they're all establishment boys, you know, patting each other on the back all the time. And guess what? The GMC refused to investigate them. So I'm in the throes of taking that decision to the High Court.
Oh, well done you. I just love you. You're amazing. I mean, you've just got such passion and drive and sense of justice, and I love it, you know, because if you weren't the way you were, I would probably still be languishing in bed, you know, not knowing what the heck was going on, you know.
Well, this is actually a form of abuse.
Of course.
And I liken it to child abuse. You know, now we're just having the public inquiries coming through about the child abuse that's gone on, you know, the 60s and the 70s and the 80s and probably before then. And we are going through the same evolution with patients with chronic fatigue syndrome who are being told, you know, get off your bed and go and walk and exercise. And guess what? It makes them worse every single time. I mean, a condition that is defined by exercise intolerance is hardly going to be treated by that. You know, it is a complete oxymoron. And it is an abuse, and the reason they can't stand up and defend themselves is because they haven't got the energy to do it.
Absolutely.
So, you know, we have to shout on their behalf because nobody else is going to. And yes, it's going to be a bumpy ride, but it's a battle that's got to be won.
Yeah, absolutely. Well, it's incredible that you're doing all this, because I know everyone is going to be so appreciative of it. And I guess this kind of brings me on to my next question. I remember you as well saying, you know, deal with the physical side and then deal with the emotional side. And perhaps, and that was very profound for me, because I knew, because, you know, we're a whole body person, mind, heart, spirit, soul type organism, you know, we're affected by different things. So perhaps you could explain even to the listeners, you know, obviously you've explained the physical aspect, the biological aspects. How do you feel the emotional? Because this is an element that, again, in mainstream medicine or the medical field doesn't have any compassion or empathy or sympathy to in any way, shape or form. And how it's not just one size fits all. There's all these multi-layers within a person that need to be treated as a whole person. So how would you kind of address that?
Well, the way I see the whole picture is that, and a very useful quote is the Mr. Micawber quote, which from Charles Dickens. And Mr. Micawber says, income 20 shillings, outgoing 21 shillings result misery, outgoing 19 shillings result happiness. So we have to make sure the income is right. So we start on energy delivery mechanisms. And then we look at how the body is spending energy. Yeah. Now, about 2/3 of all the energy we generate just goes on staying alive. Yeah. Just basic heart function, keeping warm, brain function, gut function, and so on. So we then have about 1/3 left that we can spend on things mental, like working, like talking as we are now, or physical things like gardening or running around or doing whatever we like to do. But there are two common holes in the energy bucket, as I think of them. Yeah. Now, there is the immunological hole, which is the one I spend a lot of time on. And the immunological hole occurs when the immune system is busy. Now, the immune system is our standing army. And armies are very important because they protect us from invasion by outsiders. And our immune system is there to stop us getting infected with nasty viruses, nasty bacteria, nasty fungi, or whatever. But if the immune system is inappropriately activated by allergy or by autoimmunity, or the immune system is so poor we've got a chronic infection in there, that's going to kick a hole in our energy bucket. So I spend a lot of time talking about that. And then I have what we call the emotional hole in the energy bucket. And that's when the brain is churning away and using energy uselessly almost. Yeah. And again, the brain, like the immune system, uses a lot of energy. So the brain actually makes up about 2% of our body weight, but it consumes 20% of all the fuel that all the energy the body generates. So it's massively demanding of energy. And if we are fretting about things, if we have things going round and round in our mind all the time, like post-traumatic stress, for example, then that's going to kick an enormous hole in the energy bucket. Yeah. Now, I do not pretend to be a psychologist or be good at treating emotional conditions, but what I do know, two things. First of all, if you've got the energy for your brain to work properly, you will deal with that emotional stress so much better. Yeah. And the other thing is that the normal way that the body copes with emotional stress is through sleep. Yeah. Now, broadly speaking, with sleep, we get a sleep cycle every hour and a half, every 90 minutes. And there are two parts to that. There is what's called non-REM sleep or non-rapid eye movement sleep, and then rapid eye movement sleep. Now, the non-REM sleep is the part of sleep when the brain deals with the events of the past. And for example, we don't need to remember everything that we've perceived during the course of that day, otherwise we'd fill our brain up with rubbish. So it selects the important things. It looks at our experience and says, well, okay, that was a bad one, but it's not life-threatening, so let's try and forget about it. We'll shut that away and try and ignore that. It deals with the past. And then we have REM sleep, rapid eye movement sleep, when is all about the future. It's when the brain problem solves. During rapid eye movement sleep, the body is actually paralyzed. It can't move, except the eyes flickering around, and the brain is sending connections all over the place. And so if you've got a difficult problem, you want to put it in your brain at night, and guess what? So often in the morning, the answer is there. Yeah. Now, we now know that if you can give people quality sleep, then they will deal with post-traumatic stress very effectively. Yeah. And this is work that's been done by groups of people, and the main thing that disturbs sleep is adrenaline. Now, coming back to diet, if people are running their body on carbs, their blood sugar will be up and down. Yeah. And sugar, and every time the blood sugar goes up, you pour out insulin. Every time the blood sugar comes down, you pour out adrenaline. And that continues through sleep. So at night, their sleep is disturbed by these spikes of adrenaline as their blood sugars keep falling. And what that means is they relive the events of the day, which might be unpleasant, nasty, frightening events, in an adrenaline-fueled environment. And that keeps those memories, keeps them going. And we call that post-traumatic stress. Yeah. But if you can treat those people, if you can get their sleep so that they're not spiking adrenaline, i.e. PK diet, what, of course, the psychiatrists do is they use propranolol, which is the beta blocker, to block those adrenaline spikes. You can cure post-traumatic stress syndrome just through quality sleep. Yeah. Now, that's just one of the emotional conditions that I deal with, but there's a good physical explanation. which has good physical treatment regimes. And yes, psychological therapies will give you some of the psychological tools to help you deal with that. But if you've got the energy to deal with it in the day and the sleep to rationalize it by night, so often those emotional problems melt away.
Absolutely. And I thought it was great that you were saying, let's, because when you're ill and you're stressed and your mind can go down rabbit holes before you know it, you know, and I think the very fact you were like, let's deal with the physical first. And as you say, then you get the energy, and then you can start sleeping better, and then you can start processing things. And when women start to work with me, because they're normally in a high state of stress and anxiety and emotional turmoil, I actually get them to journal first thing in the morning. So to really start the practice of just what's going on here onto paper, and, you know, mindfulness, meditation, that kind of stuff, because all these things just help coming back into the body in a different way. And then they start to sleep. And of course, then the body starts to get stronger. Emotionally, they feel more empowered. They can think straight. They've got, you know, they're feeling better. So yeah, it's wonderful. So what are the plans for you for the future? I mean, obviously you've set up this fantastic clinic. You've been pioneering in all these tests and information that are out there. And I know you're very modest about it, but really what you've done is life-changing and life-giving for so many people. So what does the future hold for you?
Well, what I'm trying to do now is to spread the word, and that's why I write books. That's why I love doing podcasts. I more often as not have doctors sitting in with me or nutritional therapists sitting in with me. I run training sessions in the summer. I'm involved on the British Society of Ecological Medicine's education committee, because I'm just trying to spread the word now. Because I mean, for decades I thought, we'll just change the doctors, you know, go and give a few lectures and they'll all see the sense of this and they'll all swap. I don't think so. No. In fact, you know, when I started getting gobby in the 20 years ago and started talking to doctors and saying this is what you should be doing, all that happened is they reported me to the General Medical Council.
I know.
Because they couldn't hack it, they couldn't get it. And so and again,
but they're just so threatened by change, because a lot of people are so indoctrinated and blinkered. The idea of change, or even think, I mean, who is it? Louis Pasteur, was he not vilified by doctors for germ theory, you know, for washing your hands, and they ended up in a mental institute, I believe, you know, and you just think, wow. And it's funny because I do talk about that to my women and say, you know, they used to cut out, you know, bits of your brain back in the 1970s and think of pure depression. So it's amazing that you have the resolve and the tenacity to keep going, because I'm sure, you know, there's a lot of flack.
One of my most hated group professionals are the psychiatrists, and essentially the way psychiatry works is a little bit like astrology. They see stars in the sky and they join up with lines. They say, oh, that's, you know, Aries, and that's Cancer, and that's, you know, Taurus or something else. And that's not science, that's astrology. And basically psychiatrists are astrologists. That's all they do. They just look at symptoms and link them up. What we need to treat psychiatry is astronomers. We want modern scientific approach. You know what's going wrong with these people when that happens. And so many brain symptoms like depression, like anxiety, as how the brain is protecting itself from itself. The brain knows it doesn't have the energy to deal with the situation.
Absolutely. Couldn't agree more. I'm so glad you said that, because this is a common thing for women at the moment as well. And even just trying to keep them focused on doing the very basics, the fundamental physical basics to start with, so that they then have the resources to deal with these things.
Yes. Correct. And you know, and yeah, the brain's a fantastic, clever thing, but its needs are very basic. And you know, if ever you want an answer to a question, you know, go back to primitive man. And these psychological conditions like OCD, anorexia, eating disorders, you know, post-traumatic stress, they're all on the up. So there's something to do with modern life that's making that happen.
Absolutely.
And to my mind, it's just so obvious. Yes, it's difficult to get back to that primitive lifestyle, and I don't say you have to run around with a rabbit skin loincloth and freeze to death to create modern primitive life. You know,
I think the psychiatrist would have a field day if you did that.
You know, we want the best of modern life, and we want the best of primitive life, in order that we can all function to our full potential and have a lovely life.
Absolutely. And it's just, I think a lot of people so disappreciate the vehicle that they're in, as in their body. They so abuse their body until their body then goes on strike and says, I've had enough, and is screaming out in pain. And then we're looking for that magic bullet tablet or that quick fix surgery or whatever, and actually not getting to the root causes. Because I think if for the listeners, their bodies are always wanting to heal. They're always wanting to come back into balance. So
Correct.
It's not complicated. It's
Correct.
just that we, as humans, like to complicate things. That's part of our nature, isn't it?
It makes us seem terribly clever when we give a complicated explanation. But I like my patients think I'm a bit dull and I don't get it very well, and that's why I have to use.
There's no chance of that.
These very fundamental, simple analogies, because then I can get it.
But I like that. I mean, there's no chance of you ever being thought of as dull. But I love your analogies, because it means then people can identify with them. And you go back to caveman, they used to sort of draw on caves, pictorial things and fables and stories, and these analogies help people get another level of understanding of what's going on, rather than them being spoken down to.
Correct.
And then be made to feel like an idiot, and
Correct.
that there's something wrong with them.
The fact of the matter is, there's only one person that's going to get my patient better, and that's my patient.
Exactly.
Now, I can point them the path, I can give them the rules of the game, I can give them the tools to trade.
And you can crack that whip every now and again, can't you? Crack that whip.
Crack the whip. I don't like cracking the whip. But
you're right. Only the patient, only the clients can get themselves well. And I think, but certainly your energy, your passion, your belief, and that's what I hope to do with my women, or I do with my women, I'm like, you have to do this. I'm not going to do it for you, but I'm here. If you're doing all the stuff you need to do, I will run alongside you,
Correct.
to get you where you need to go.
And the other thing is, there's a certain momentum about getting well.
Yes.
And so any of my patients can email me at any time. And if it's a quick question, I can file them back and keep that momentum going. If it's a shopping list, okay, I might spend more, might take a little longer to get back to them. But, getting them going and keeping them going is a really important part of recovery.
Absolutely. And just keeping these things going. Well, thank you so much indeed. So if people want to learn more about you and what you're doing, where should they go to get more information?
Well, there's my website there, which we try to keep up to date, and there are lots of different pages there. And I try to make the name of each page explain what's within that page. But I try to encompass the whole of medicine. But increasingly these days, I'm writing books about chronic fatigue syndrome, about the diet, about the infection game, which is how infections have the potential to make us ill. And I'm now rewriting sustainable medicine, which I call ecological medicine, which is about the whole of medicine. I'm now on chapter 78, so that would be the Bible.
I was going to say that is the Bible. So so is it drsarahmyhill.co.uk? Is it?
That will do. Yes, it comes up very easy on the.
I'll put details in the link anyway. But and obviously you're on Amazon and things. But I just want to say again, for the record, you were amazing, and I think a couple of years ago I reached out to help in a certain situation that had arisen, and you were there. So thank you so much again for who you are, for what you do, and I very much appreciate it. And thank you so much for coming on.
My pleasure. Have a good day.
Thank you.
Bye.
Thanks for listening to Heal Endometriosis Naturally with Wendy K. Laidlaw. And I hope you enjoyed the show. Don't forget to subscribe, like, and rate us. If you're interested in learning more, you can download your top 5 jumpstart tips at healendometriosisnaturally.com and jump on the VIP email list. Remember to keep you number one, for the world needs a healthy you.